you, Ashley, Thank you for reminding me, Ashley. So I will be recording the session. So I know some of you are driving, some of you might be popping in and out of this session. You will have access to this at the end of today's session. In addition to the work that I do with Kids Mental Health Pierce County, I do education consulting all across Washington State. So I really work with school districts to understand what multi-tiered systems of support look like through a culturally responsive and a trauma-sensitive lens. So understanding what MTSS means in terms of the tiers, but really getting into the deeper foundational work of how do we ensure that our systems within a school building or within an institutional setting are trauma sensitive as well as culturally responsive. During this session today, we will have a couple group norms to just, kind of recognize that we're all in different places right now. Literally, physically, we're all in different places, but mentally we all are too, right? This is the first week back for a lot of people within a school setting. So just being able to hold ourselves accountable mentally and physically. There will be some opportunity to do some conversations and to use the chat box. So participate to your comfort level. And also recognizing that these are pretty challenging conversations, right? Talking about kids that we work with who have really significant escalations can also sometimes bring up a lot of emotions for us as the adults as well. So we really want to work today to keep our conversations positive and keep our conversations solution oriented. And for our learning targets, we will be analyzing the importance of prevention, specifically as it comes to our own self-awareness. We're going to learn about the different responses of working with and supporting youth who are escalated. We're going to recognize the impact of trauma. So really, what does that look like and how does that add some unique layers of challenges when we are working with escalated youth or even escalated adults, which I'm sure some of you have had experience with. And then I will, of course, be providing you with a lot of strategies today. Some of the work that we will be leaning on might be familiar to you today because there'll be a couple times that I reference right response, which is a curriculum that is a restraint and isolation curriculum for youth in a school setting or in an institutional setting who are significantly escalated so much so that they are unsafe for themselves and others. So there will be a couple times that I reference right response today, in addition to the other work that we'll be discussing. As we know, when it comes to our students, oftentimes the behavior is the first thing that we see, right? And it can be pretty obvious for some of our kids. The things that we don't see and the things that have a huge influence over our students' behaviors or our youth's behaviors is, are their physical and emotional needs being met? What is some of their past trauma, some past experiences? Do they have a sense of belonging within their family, within their community? What type of significance are they feeling? What are their own motivations, their perceptions? What are their values and beliefs? These are the things that we have to start unpacking when it comes to looking at students' behavior or youth behavior and determining how are we going to support them. Now, I know in a school setting, and I'm going to be talking about this more later on during the session, in a school setting, typically we need to complete a functional behavioral assessment for a youth if their behavior is really impeding the learning environment for themselves and for others. Oftentimes, what we don't address and what we don't talk about is that when youth are significantly impacted by trauma, and a functional behavior assessment is not going to work in and of itself. It's not what we need to do to support the youth's behavior, because traditional methods that are used within an FBA, they're oftentimes when youth are impacted by trauma, those traditional methods are not going to work only by themselves. And so we'll talk a little bit more about what that looks like when students are really impacted by that trauma. Now, there are a couple guidelines for how we are to engage with youth who are escalated, right? And we're going to talk a little bit about what are some of ways that we see escalations and what does that look like in your own setting with how you work and support youth. Oftentimes it looks different at home potentially than it would in a school setting, than it would in a therapeutic setting. But the first thing we always have to focus on is our prevention, right? How are we preventing the behaviors from happening in the first place? When we start to see that youth continue to escalate and the preventative methods are not working, that's when we want to kick into the de-escalation, right? The practices that we're going to be learning today. When we de-escalate, our actions always have to be focused on safety, right? In the moment, it doesn't really matter what the kid is saying. Is the kid safe? Once we get to the point where our youth are de-escalated, that's when we restabilize, right? We understand what their motivations are. We start to learn more about how they're feeling, where they're at, what happened during the escalation, and we restabilize them in order to create a teachable moment. And the teachable moment might not be that day, right? Teachable moments oftentimes with escalations happen in really small chunks. But the goal is that eventually, through the work that we're doing with the youth, in addition to all the other wraparound supports that are being provided for that youth, they are able to start to regulate for themselves more quickly, so the de-escalation takes less time. So we're going to watch a quick little video. This is one of my favorite videos, my favorite little clips from the Water Boy. And so I'm going to play this, and just if somebody can let me know, text or put in the chat to make sure that you can hear it. As we are watching this, just go ahead and start thinking about the questions on the left-hand side. Does the teacher in the setting increase or decrease the student's escalation? Could the teacher be doing something differently? And what are some of those actions?
So, why you pick this class anyway? It's pretty hard.
Oh, beautiful view.
All right.
All right, all right. Y'all shut up now. Now, last week, we talked about the physiology of the animal brain as it pertains to aggression. Now, is there anyone here that can tell me why most alligators are abnormally aggressive?
I know the answer to this question. Raise your hand.
Anybody? Anyone? Yes or you, sir?
Mama says that alligators are ornery because they got all them teeth but no toothbrush.
Your mama said alligators are ornery because they got all them teeth and no toothbrush. Wow. Anybody else? Yes, sir, you, sir.
Alligators are aggressive because of an enlarged medulla oblongata. It's the sector of the brain which controls aggressive behavior.
That is correct. The medulla oblongata.
But Mama said...
The medulla oblongata is where anger, jealousy, and aggression come from. Now, is there anybody here can tell me where happiness comes from?
No.
Anyone?
Oh.
All right. Let's hear what Mama has to say on the subject.
Mama say that happiness is from magic rays of sunshine that come down when you're feeling blue.
Well, folks, Mama's wrong again.
No, Colonel Sanders, you're wrong. Mama's right.
Mama's right. Mama's right. Something wrong with his medulla oblongata.
It's okay to fight back. Coach Klein said I could. Mr. Coach Klein said I could. It's fine.
All right. So before we move on, I want us to think about what does the teacher do in the very beginning to either decrease or increase the student's potential escalation? What's the teacher's personality? And go ahead, you can either unmute yourself or you can type it in the chat. Yeah, rude, superior, right? It says shut up. It's totally escalatory. I have definitely felt like saying that to classes. Don't get me wrong, Juliet, but I have never actually said that to a class, right? It's very, the teacher in and of himself is very dismissive, right? Makes fun of the student. How does this get the other students in the classroom going? What happens? What do we see? Yeah, he allows the behavior, right? He allows them to start laughing and they think that it's okay. They start joining in. Yeah, it gives them the permission. Sometimes, whether or not we know that we do this as adults, we might actually increase the student's behavior, right? Increase the student's escalation, I should say, or the youth's escalation. And it's not always this obvious, right? It's not always us coming into a classroom and telling them to shut up. Sometimes it's when we talk about the youth when they're right in front of us, but we act like they're not there, right? There are things that we can sometimes do that either inadvertently or not increases escalations in youth or frustrations in youth. So how have you seen that, or how have you seen or experienced it within your work environment? Yeah, Lena, I love how you put that. Does not affirm the risk of answering regardless of questions, right? Or correctness, definitely. So again, either in the chat or please feel free to unmute yourself. How do you see or how have you experienced adults inadvertently or not increasing youth frustrations? Yeah, use of sarcasm with students. Absolutely. Yeah, the tone will escalate kids. Facial or body expression, definitely. Yes, using students as non-examples. Yeah, that's definitely Colleen. They become escalated right along with the kid. Yes, staff perspective doesn't match student racialized perspective. Thank you for calling that out, Claudia. Yeah, being condescending. Yes, getting in in people's personal space, right? Invading their space. All of these, this is so much of what I'm going to be touching on today. And a couple things I want to point out. Quite a few of you mentioned different things about tone, about facial, body expression, sarcasm, which oftentimes has to do with tone. They say that communication is about 20% of the words coming out of our mouth. 80% of the rest of communication is everything else. It's our tone, it's our speed, it's how we're using our hands, our body language, our facial expressions. 80% of the way that we communicate. Yeah, inflexibility, not understanding the relation to the student's sensory needs. Absolutely, sensory is a big one. So when we start to think about escalations, it's really important to recognize that sometimes, whether or not we want to admit it, we might be increasing a student's escalation. Oftentimes when I get called into a school building to observe student behavior and to support with behavioral assessments, I'll walk into a classroom and immediately, right, the student is already starting to escalate, and immediately the teacher will just start telling me all the bad stuff about the kid, right? And I'm not here to say that any teacher ever is doing that on purpose. It's because our frustration level is also pretty high sometimes, right? When the same escalation continues and continues and is disrupting either the home environment, the therapeutic environment, or the school environment, adults also get frustrated. It's a natural thing that happens to us. And so part of our responsibility, because our brain is fully developed, unlike the kids that we're supporting, is that we have to make sure that we are monitoring and managing how we are handling the situation in order to best support the kid. When our students are impacted by a stressful situation, So when our youth experience a really significant stressful event, which for some of our youth we know could be switching homes over the weekend. Friday night they go to one parent, Monday morning they're back at the other parent. For some of our students or for some of our youth, it could be getting a challenging homework assignment. For some of our youth in foster care, it could be not knowing what home they're going to be in this weekend. The part of our brain that first responds is called the amygdala. And this is kind of like what contributes to our emotional processing. The amygdala sends an immediate distress signal to the hypothalamus. And that is the command center of our brain that communicates with the rest of the body, in particular the nervous system, so that we can fight, flight, freeze, or fawn. Right? Fawn is the new F word that has been researched most recently. And when an individual is impacted by fawn for their stress response, it's when they immediately start acting like they're trying to please the person to avoid any conflict. So we see that a lot with individuals impacted that have been abducted, for example, domestic violence. Yeah, it's so common with kids and we don't talk about it enough. Fawn, right? Absolutely. And so it's really important to recognize that when our kids are under a lot of stress, whether that's from trauma or chronic stress at home, such as neglect, they are living in this fight, flight, freeze, or fawn. That's how they are surviving. And if you've been in my PDs before, this is going to be very familiar to you, but I know many of you haven't, so I want to go over it. Our survival brain is this part that is red at the very bottom, right? This is what we call our reptilian brain. It is the first part of the brain that is developed in utero, right? It's the first part of our brain to get developed. The survival brain is what is responsible for that command center of fight, flight, freeze, and fawn. So when we are impacted by a traumatic situation, or by chronic stress, we are living in our survival brain. The next part of our brain to fully develop is the emotional brain. That's right in the middle of our brain. That's what holds the amygdala. It's our limbic system. The emotional part of the brain is fully developed during puberty. So if any of you are middle school educators, foster parents, anything out there, if you work with middle schoolers in any capacity, you know that our middle schoolers tend to live in their emotional brain. And that means that they see the world through an emotional lens. And it also means that their thinking brain is actually kind of paused with development, because it needs to fully develop the emotional brain before our bodies have the energy and the capacity to fully develop our neocortex, which is our thinking brain. The neocortex, in particular, the prefrontal cortex right in front of our brain, is what is responsible for all of our rational decisions. It's what's responsible for when we make a good decision or a bad decision, for our choices, right? I like to think of like our thinking brain as like that little angel on the shoulder, right? And sometimes our emotional brain can be the little devil on the shoulder, right? So our thinking brain does not fully develop until our mid to late 20s, as a matter of fact, right? 25 to 27 years of age. And oftentimes when we work with youth, especially youth impacted by trauma, they aren't necessarily living in their thinking brain. They are living in their survival brain, right? They are just figuring out how to survive. And the other problem-solving skills are not there because they either fight, flight, freeze, or fawn to get their needs met. So the other important thing to recognize about the survival brain is that for our youth, if their basic needs are not being met, they are also living in survival brain. And we put a lot of pressures on kiddos in this world, in our society, and we expect them to sit through a school day, to have big conversations with other adults, to understand what the expectations are. But when kids are impacted by trauma, oftentimes it means that they're living in that survival brain. And so their thinking brain is not firing at all, or very, very little. Now, the thing is that when we live long enough in our survival brain, this means that our prefrontal cortex does not fully develop by the time we are 25 to 27 years of age. Right? That development slows down because we have not been given enough opportunity to be living in that pre-cortex, that thinking brain. Any questions about this? All right, and if any questions come up, please feel free to plug them into the chat. So this image here is taken from Right Response, but in my experience, this image of the escalation cycle, or as Right Response calls it, the stress cycle, is one of the best ways that we can see physically what goes on when we or when a youth escalate. So what we have here is we have our baseline. Our baseline is anytime that we are just like feeling good, having a good day, everything is going right. For ourselves, what do you need when you are like, oh yeah, I'm at my baseline today, I'm having a good day? What does that look like for you? For me, it's like caffeine every single morning. I need to make sure that my to-do list is done in the at night before I go to bed, right? These are things so I know that I'm setting myself up for success the next day. And go ahead and plug into the chat. What are some other things for you? Yes, as we are, as people are thinking about what they are, what their baseline looks like or what that feels like for them, I am going to answer Juliet's question. And the question is, can they still develop the prefrontal cortex part of their brains after age 25 to 27 if trauma has slowed that development? The best thing about our brain is it's probably like the most malleable thing in our body. And yes, it can still be developed, although it is really important to recognize that it is developed through a lot of therapeutic supports, right? Cognitive behavioral therapy is a really big one, and other talk therapy options. But yes, it can be developed afterwards. Yeah, having a positive start to the day, a daily routine, definitely. Plenty of rest the night before. We don't always get it, but yes, I have a much better day and I can handle challenging situations better if I get sleep the night before. Same page with a partner, right? To start the day, getting exercise, coffee, and uninterrupted sleep. Definitely. Yeah, I see some themes here. Yeah, follow through on routines, right? Food, restful night's sleep, absolutely. Yeah. You know, one of the best things about routines is that we love routine, right? Like human beings love a good routine. And then come like March 2020, all of our routines got a little crazy and we kind of had to live, we had to learn how to live in some ambiguity for sure. But I'm a big advocate for routines as well. When we start our day on baseline, right? We're feeling good. We got a good night's sleep. We're following our routine. Chances are we are going to be able to handle situations better. We can think more thoroughly, right? We're able to calm down ourselves. And that's because we start our day off in our thinking brain, in our prefrontal cortex, being able to make hard decisions, problem solving. As an advocate, I counter young parents with this delay. Yes, that's so important to recognize and to talk about, Patsy. And really, it's important whether it's young parents or just young adults in general. Kids are at the age of 18, we consider them adults in this country. And their brain does not function like an adult's brain, right? But we still put a lot of pressures on them to act like an adult and to make the right choices. And at the end of the day, we have many, many high schoolers. I have an 18-year-old high schooler in my home who is definitely not an adult, right? But sometimes likes to think he is. Anything else for baseline? So when we enter a space at our baseline, we are going to be able to handle situations better, right? We're going to be able to problem solve and work through tough situations and escalations. What we know about our students impacted by trauma is that oftentimes this red line representing our perfect range, right? The optimal performance range, that's not where our youth are, right? They might not even remember what their baseline is. We have youth that we work with and that we connect with that enter our space much higher towards this alarm phase than they do towards the optimal performance range, that baseline. And the closer a kid is towards that alarm, the higher the likelihood that they are going to immediately go into a full escalation or quickly go into a full escalation. So how do we know for the youth that we work with, when they enter our space, what are some of those what we call red flags that they might not be at a good baseline? What are some red flags that you've seen with students or with youth? Yeah, irritability, negative affect. Yeah, body posture, withdrawn. Yes, facial expression, tone of voice. Yeah, red face, that tone again. I don't know about you, but sometimes I've worked with youth that like come in with their hood up and super tight around, right? They are like literally physically shutting themselves off from me. Yeah, lack of eye contact, not wanting to talk for sure. Yep, that closed off body language. Non-affect. Oh yeah, that's a big one, right? Head on table. Yep, absolutely. Right, so our youth oftentimes will start to give us some red flags, and we only know that when we start to get to know our youth. I always tell this story because this is kind of like a what not to do story. One of my first years teaching, it was probably my first or second year, and I started my career in West Seattle, working at an emotional behavioral disability program. And I had one student who he came to me as a sophomore, so he was like 16 years old. And by the time he was in my classroom, since the age of 7, he had already been in like 24 different foster homes or group homes, right? So between the ages of 7 and 16. And he was with a new foster family that was supporting him. And all like the week before he had come into my classroom, so it was probably like a Friday, he had been talking about wanting to get his hair cut. He had a really big afro and he was like over it and he wanted to get the hair taken off. He was African-American student, and at the time his foster parents were 2 white dads who had never fostered a Black or African-American student before, and brought him to their hair salon essentially, and just like honestly, the hair salon just kind of butchered his hair, like absolutely butchered it. And we had, because typically in my classroom, once every 2 months or once a month on Fridays, we would bring our students to a barbershop that was down the street that worked with our students really well. And we had a good relationship connection with them. So we had kept telling him like, dude, just wait it out, wait to get your haircut until we take you to the place that we know on Friday. He didn't do that. He came into the classroom, was super upset about his hair. And then to make matters worse, that night after he got back home from the haircut, he had tried fixing like the edge. It was just terrible. It was not good. And so he came into my classroom that morning and he had his hood up. He had tied it super tight around his chin. He refused to talk to me. And I like immediately, because we had a pretty fun banter, him and I. So I immediately just started joking around with him about it. And he kept doing red flags, like these little red flags. He got up and started pacing my classroom. And at the time, I just didn't catch on that I needed to like zip it, right? So this was a perfect example of me inadvertently increasing the likelihood of his escalation. I was making fun of him, essentially joking around, being sarcastic, and it didn't work. It did not go in my favor, right? So these are sometimes things that we just have to recognize working with youth. The likelihood that we might cause an escalation is there too, right? And that happens. And that's when we go into, well, how do we build that relationship? After a youth has an escalation, 99% of the time, they are going to go into an exhaustion phase, right? And this is another reason why I like using this right response visual, because most individuals go into an exhaustion phase where you actually dip below what we would consider baseline to exhaustion. You fall asleep. The emotions that come up for kids oftentimes during this phase is guilt, shame. Sometimes they try to put blame on others. Sometimes crying, right? Sometimes tears. But this is typically what you are going to see in an escalation with a youth. Now, what we need to recognize is that when our youth are going through this escalation, which looks like a crazy roller coaster ride, we don't want to get on the ride with them. We want to stay as close as possible to our baseline so that we can continue to support them. If you find yourself working with students that are challenged with regulating their emotions or that escalate quite a bit, and you find yourself going home after work and falling asleep by 6 or 7 at night, or crying, or wanting to just like bury yourself in bed with a bottle of wine, chances are you are engaging in this stress cycle, in this escalation cycle as well. And that's when it's really important for us to acknowledge what we need to do to support ourselves too. Rod, I just assume at this point that you do all those things, whether or not you're engaged in the stress cycle. That's just Rod on a fun Monday night, right? I would say it's not necessarily bad. We all have our moments, but it is really important to recognize if that is out of the norm, then we probably need to figure out what type of self-care to start working on, or how to support ourselves. So this visual is another example of just the ways that fight, flight, freeze, and fawn show up. And why I love this visual is because we that work with youth impacted by trauma sometimes hear the mislabeling of youth, or sometimes might also mislabel youth. And so this is what these survival skills, because fight, flight, freeze, and fawn end up becoming skills for some of our youth, are typically mislabeled as. So when you're thinking about stress, when does stress benefit us, right? When do we want stress? Yeah, when going into an interview, when we're in danger. Yeah, emergency situations. Yeah, it's really important to recognize, like, sometimes stress is good. Sometimes we need stress. Competition. Absolutely, right? When we have to meet a deadline. Some people are the best essay writers ever when there is an essay due the day before or the next day, and they're up at like 3 a.m. trying to finish it, or for some people trying to start it. I do not work well like that, but some people do work really well like that. So there are times when a moderate amount of stress, just like Andrew said, is beneficial to us, right? It can help to assist in that motivation. So I mentioned earlier, but prevention is really key. It's really important that we recognize and focus on talking about and understanding the real meaning behind preventative measures when supporting escalations. The best method for responding well to any youth who is escalated is to anticipate and prevent the full escalation cycle, right? And we do this through our own self-awareness, through observation, and through the assessment of needs. So if we have a youth who is halfway between baseline and alarm, right? So they're escalated, but they're not having a full-blown escalation. If we can support them there, that is going to be more beneficial for the youth and for us than not being able to reach them until this alarm phase. When we talk about preventative measures, every type of system does things differently, right? What in your workspace are some prevention methods that you all use for youth? What does that look like? What do you do to support a youth from not escalating? Checking in. Yeah, take a student on a walk. Breaks. Absolutely. Morning check-ins. Yeah, all of these are great examples, right? A cool off corner. Some schools use a buddy room. Yeah, Andrew points out, find out the underlying needs, right? Are they hungry? Do they have a pain? Is it some type of sensory dysregulation? Moving seats, definitely. Yeah, teaching skills for emotional regulation. Food and water, using a calm voice. Yeah, allowing them space, right? All of these are perfect preventative measures, right? Sometimes easier said than done, but all of these are great ways to support a youth when they are starting to escalate or before the escalation. Yeah, and so, Maya says, as you mentioned, anticipation based on knowledge of their situation and history, compassionately responding in the moment and prioritizing connection, being available, right? So the truth is, we're not always going to be anticipate because we might not always have all of the information, right? And that's okay. But being able to prioritize connection is key, right? I am going to go to my grave telling people that relationship building is the most important thing before any other academic or educational needs are met. It has to begin with relationship. We also need to recognize that there is some level of self-awareness, right? The truth is that we're not always the best people to de-escalate in the situation. The first thing I do is I take a deep breath, right? I did it just now. And anytime I walk into a stressful situation, that's the first thing I do. I physically want to make sure that I am calm. And I think about how my body is reacting to the situation. Am I anxious? Are my fists clenched up? Right? If I am aggravated or if I am angry, I'm probably not going to be able to respond in a calm way. And then it's not going to work, right? It's not going to be helpful. If you are feeling tense, not because you're angry, but because you're nervous, and just so you all know, it is 100% normal to be nervous when you are supporting somebody that is escalated, right? See if you can relax yourself. When we start to relax ourselves, we are going to be able to respond in a more centered way. And it's also really important to recognize how our own privileges come across to others, right? How do the youth that you work with of other racial and ethnic identities experience you? Is that even a question you thought of before? How do people of other gender expressions experience you? And so there are times when we have to ask ourselves, are we the best person to engage with this situation? Or is there somebody else that might be looked at as more safe or more trustworthy? Yeah, absolutely. Keeping yourself calm models that for the child too. And this is not just for youth that are impacted by trauma. This is also for youth and people in general, right? When I get frustrated at the kiddos in my home, in the moment when I'm really mad at them, I'm not usually the best person to handle the situation, although I like to think I am, right? That's when I have to get my partner to handle the situation. If you have kids at home, you know what I'm talking about. Sometimes the best thing when we start to recognize our own self-awareness is we take that deep breath and we walk away and let another adult handle the situation. And that's okay, right? That's okay. This is, I believe, the last thing I'm going to reflect on in reference to right response. And this is, right response breaks down cognitive distortions and how they impact us when we are presented with an escalated situation. And truthfully, cognitive distortions are really these mindsets that put us into some patterns of thinking and patterns of behavior that are not helpful when we are working with an escalated youth, right? So if we enter a space in a victim mindset, that means that we think that it's all about me, right? Everything happens to me. The principals would never put this kid in my classroom, or the principals would never put this kid in any other classroom, just my classroom. My supervisor would never give this kid to any other case manager, just me. And oftentimes this can lead into some results that aren't helpful. They're not helpful for us and they're not helpful for the individual. The same goes with polarity mindset. This is when we think in extremes. Everything is either the worst case scenario or everything is like not a big deal, right? The story I told you about the student who got the bad haircut. I was in a polarity mindset where in my head, I was like, it's not a big deal. Hair grows back. I am also a white woman that can walk into pretty much any salon I want to and get the haircut that I want because I just asked for a trim, right? My student, I could not experience what he was experiencing in that moment. And so I was seeing the situation as it was not of consequence. It wasn't a big deal. Why is he so upset about it? Which meant that my behavior in return was that I did not see his perspective and it wasn't helpful for the situation. It escalated him. We also have emotional mindsets, right? We see this a lot in middle school youth in particular, that whole idea of I feel it, therefore it is true. The best example of this I have in terms of youth is if you work with that kind of tween age or young teens, so I would say 11, 12, 13 year old kiddos. And, you know, it's like 4 best friends. And one of them was in a relationship and the night before they got broken up with. And now they all come into your space, whether that's your classroom or your counseling office. And all 4 of them are crying and emotional as though they all got broken up with, even though just maybe the one got broken up with, right? So this leads to oftentimes really emotional outbursts, right? Sometimes it can lead to power struggles. And then we finally have that perfectionist mindset. Nothing is ever good enough. It doesn't meet your standards. This can make us hard to work with, make us think that we're always right. So these cognitive distortions do not just impact us during an escalation, right? We are always going through different distortions, right? We're human, this happens. It's really important when we are supporting a youth that is impacted in the moment by an escalation, that we check ourselves to see if we are seeing the situation through a cognitive distortion, because it's going to be very hard to de-escalate a situation. So something for you to consider, and we're not really going to talk about this, but for you all to consider. Which cognitive distortions affect you, and what does that look like? How do they affect you? It can be different in a work setting than it can be at home. At home, I tend to have more of an emotional mindset, right? And then just starting to think for yourself, what do you need to do to change any type of cognitive distortion that is not helpful in managing any type of stress or students or youth? How would you have to shift that mindset? All of this work really starts with that inside out change. We have to change our way of thinking and responding in order to make a difference in the situation. If we keep responding the same way and it's not working, we have to change. And, I just want to reiterate that de-escalation techniques feel abnormal in the moment because we also are feeling anxious. We are all driven by survival. We all either want to, when we are faced with a stressful situation, fight, flight, freeze, or fawn. When we are de-escalating a youth, we can't do that. Reasoning is also usually not possible with an escalated youth. I don't know if you've ever tried it, but it's not easy, and I would not suggest it. Which means that we are kind of sitting in this situation until that de-escalation starts to really work for the kid. The most important objective when we are in a situation of de-escalation is to reduce that alarm reaction, right? To reduce the likelihood that the youth are going to end up at the top of that roller coaster. The sooner that we can start that student or that youth having a conversation with us, the more growth we are going to see. So, ways to reduce the likelihood of escalation. Is there any questions about the self-awareness piece or about the prevention piece before we move into reducing the likelihood? All right, if there is, please feel free to plug it into the chat. All right, so when we want to reduce the likelihood of an escalation, which probably is all the time, like I said before, breathe. When we breathe, it regulates our nervous system. We are going to feel nervous and anxious, and we are probably going to feel like we want to fight, but we can't fight our youth, or flight, we can't run away from them. So the more that we breathe, the more likely we are able to maintain our cool because it literally calms our nervous system down. And like I put here, and I'll explain this, we want to appear calm even if we're not, right? And so I used to work with somebody that always told me when I was doing de-escalations of youth pretty much every day, multiple times a day. And he told me like, oh, you're just like a duck. And I kind of thought I was going to take offense to that because I didn't know what that meant. So I was like, what does that even mean? But what he said is that on the surface of the water, I am like so calm, cool, and collected, right? Like I'm so chill. But he knows, because him and I work together all the time, that underneath the surface of the water, I am like kicking like hell to stay afloat, right? And that's okay. In the moment, we might have to do that. But the point is that we don't want our youth to feel the energy as though we are anxious or we are nervous or we are scared. And I always thought, like, if my heart's beating really fast, aren't they going to feel that from me? And he, the guy that, my partner in crime at the time, said that he never once would have ever guessed that I was nervous or anxious during a de-escalation because he never felt that from me. It's absolutely fake it till you make it. Yeah. We mentioned this earlier, but using a slow, monotonous voice and tone. Now, some of you have been in these sessions with me since October. You know that I am a fast talker. My tone is also like higher than the average tone voice, right? When I enter a space that of an escalated individual, whether it's a youth or an adult, I bring my voice down. I lower my tone. I slow down my speaking, and it feels really awkward during a Zoom presentation, but I always do that very intentionally. That is one of the best ways to make yourself feel calm and make sure that the youth is seeing you in a calm way. Sometimes it's better to move the situation into a space that helps decrease anxiety. If the escalation maybe started in an office, maybe out in a hallway or out in a more open space. And this is another thing, and some of you might experience this if you are a principal, a school counselor, school social worker. Sometimes we might be brought into a situation where there's an escalated kid that we don't know even their name, but for whatever reason, we are the ones with the magic fairy dust that can stop the escalation, right? And so I'm sure some of you have had that experience before. If that is the case, and if the youth does not know you, and if you do not know the youth, introduce yourself. Let them know that you are there to help. Right? That's the first thing we want to do. We don't want to enter a space where we are just another stranger that is, observing this escalation happening, right? When youth escalate, they're not doing it because they want to, right? A lot of shame and embarrassment comes after the escalation. So make sure that you just introduce yourself. You don't put any hands on them. Give them, 3 feet of space, but tell them who you are and why you're there. And once again, if you can't respond to the situation, if you are not in a good space to do so, find someone else who can. We also want to make sure that we avoid being defensive. We want to maintain the respect for the youth. We want to avoid talking about them in front of them, which sounds probably obvious, but it happens all the time. And allow space to move around. The injuries that I have seen that staff members have gotten, the majority of injuries is just because they were too close to the youth that was escalated. As a reminder, when we're talking about behavior, and escalations are a form of behavior, all behavior is communication. And we talk about function of behavior a lot, right? So what is the function of the behavior? Which means, what is the youth trying to gain? What is the youth trying to avoid? And I'm going to go into this a little bit more and talk about when it works and when it doesn't work. But I just recently found this Little Mermaid meme. Is it a meme or a GIF? I still can't remember what's what. And I absolutely love it because oftentimes one of the first rules of thumb is get the kid on a behavior tracker and let's see if that helps their behavior. And oftentimes when I hear that trackers don't work or stickers don't work, and when I work with and support parents, we talk about this as well, it's usually because the stickers don't represent anything. The youth doesn't know what they're working for or what they're working towards, right? And that's when token systems don't work, is when they aren't working towards something. This meme in the top left-hand corner says, if you're given a task you don't want to do, just start crying. They'll send you straight to the thinking chair. It's like a vacation from work, right? A lot of our students know what they need to do, or a lot of our youth know what they need to do to get out of a meeting or get out of a classroom environment. Youth have learned that their behavior works for them, right? And these are the only functions of behavior: escape, avoid, gain attention, gain an activity or an object, or sensory input. That's it. It sounds a lot easier than it is, though, when we have youth impacted by trauma. When you think about in your setting with the youth that you support, what behavior have you seen youth exhibit to gain attention? What does that look like? How do youth try to gain attention? Yep, shout out. Yep, elope, to go to their favorite adult usually. Yeah, talking out, right? It's easier to be the funny person. Oh yeah, I like that one, Sean, flipping people off. I could see why that would get some attention. Yes, withdrawing, definitely. Yeah, all of those are ways that we know some youth, what they'll do to get attention, right? What have you seen youth exhibit to avoid? Let's say avoid something tangible. And that could be like maybe a meeting, it could be work. What do youth do to avoid something tangible? Yep, go to the bathroom. Yeah, they just don't attend. Walk out of the room. Yes, sick. Absolutely. Yeah, I see the sickness. I see that a lot, especially this time of year, where, well, like with the holidays, youth impacted by trauma, youth in the foster care system. I work at Echo Glen, so youth that are incarcerated, they start to get sick. And really, you know, it's that manifestation of stuff that they're missing, right? Their parents, their family, their friends. Yeah, do something to get sent out of the room. Yeah. Youth have acted out or been aggressive to avoid the quietness or connection that a longer, yes. Angela, thank you so much for pointing that out. You know, the kiddo that I had, the story that I told you about with the kiddo and his poor haircut, you know, that family, that parent's home that he was in was his longest foster care home ever. And I think he had been there for about 6 months when he started to not like feeling like a family, right? He got really uncomfortable with what that felt like, so much so that he started acting out really aggressively towards the parents, and ended up having to get moved out of that home and into a group home. But that is something that is really common. And I think a lot of people don't understand, right? When they're like, but they're in such a perfect foster family, the family wants to adopt them, it's such a great home. There's a lot of emotion for kids that come with that. So that's real. It is amazing how many behaviors show up, and like, no matter how many behaviors I hear about, or when people tell me in these sessions, there's still going to be a new behavior tomorrow that I'm like, wow, I have not heard of that yet, or I have not experienced that yet. Now, the reason why I've been bringing this up a little bit, to talk about and really understand escalations and trauma, is that it's really imperative we understand oftentimes traditional behavioral approaches might not be successful. We know this when we start to see that efforts to teach alternative behaviors is not working, and or when we see that rewards or consequences actually trigger the behavior, right? This I see a lot when it would appear that the youth wants adult attention, and then the teacher starts giving adult attention to the youth in front of the class, and then that immediately escalates the kid's behavior, right? When rewards and consequences trigger behavior, which is different than when they don't work, but when they trigger the behavior, that can oftentimes show that there's probably some underlying trauma there that needs to be addressed. Also, when traditional FBA approach is not successful, and FBA stands for Functional Behavior Assessment. This looks like for us when the antecedent behaviors, which we're going to talk about, and the patterns are hard to identify. We can't tell when the student gets escalated or the youth gets angry. There's no pattern to where the behavior occurs. There's no pattern to who is present. It kind of happens out of nowhere. We also know that function of behavior may be neurological, which means it might not be observable. There is no outcome driven from it. And so this is when we start to determine, okay, more supports need to be addressed because a traditional academic behavioral approach or educational behavioral approach is not going to work for this youth. And I'm sure some of you now are thinking in your head some kiddos that might be happening with. Now, to reference the setting events, or what we sometimes call antecedents, right? So this is a pathway chart to really show us how additional stress and challenges do that compounding of behavior, right? And just as a reminder, when we talk about setting events, these are not limited to classrooms. They're not limited to your place of work. Oftentimes, setting events happen before they enter your space. Right? So setting events are what increase the likelihood that the trigger will provoke a behavior. The trigger is what happens right before the behavior, which provokes it, right? So the setting event is like the gas, the trigger is like the flame, the match. The problem behavior is the concern. The problem behavior is maintained by a consequence, which means the function of behavior. What are they gaining or what are they avoiding? In your experience, what are some examples of setting events?
I found this on the web.
Well, Siri's trying to answer for me. Right, I saw one person had mentioned hunger, right? That's a really good example of a setting event. Yeah, oftentimes demands or requests are the trigger, right? Something has happened beforehand. And then when you say, hey, can you fill this form out for me? The kid escalates. Yep, no sleep, absolutely. Huge setting event. Change in routine, that's a setting event for all of us. Yeah, conflict at home. Not having breakfast, yeah. Yep, med changes, my goodness. Med changes are huge. Yep, being at the doctor. Oh, wanting to impress and failing. Yeah, staffing. My gosh, this year more than ever, I'm working in one school district right now, a small school district, and they have, gosh, I want to say the last time I was there in November, they had like 8 paraeducator openings. Like they needed 8 paraeducators that they were missing, and it's a district of just 3 schools, and so there's 8 paraeducators and like 6 of them were one-on-ones for students. It was pretty crazy. Unexpected sudden changes, trauma anniversaries. Yeah, puberty is huge. Peer issues. An important thing to also consider with puberty, if you work with youth at that age range or that age group, is medication. It is incredible how much puberty affects medication. And so if you have worked with a youth who, prior to puberty and they seem to stabilize on medication, and then during puberty stuff is going on, that's important to remember and have that conversation that medications might need to change. Yeah, trauma anniversaries is huge. So what I am referencing about when traditional behavioral responses will not work is when we are really having a hard time understanding what is setting the student off, what is setting the kid off. And when those are hard to determine, typically that means that traditional behavioral approaches will not support the student. And it's all about that setting event. We need to focus and highlight relationships, right? This is culturally responsive of us. It's trauma sensitive of us, right? There is no more effective neurobiological intervention than a safe relationship. And somebody earlier had asked if by the age of 27, the prefrontal cortex is not fully developed yet, can it ever be fully developed? with relationships it can be. The reason why relationships are the most effective neurobiological intervention is because when youth feel safe, when youth feel grounded, we are, as the adult who helps them and supports them, we're able to pull them back into their thinking brain to fully develop that thinking brain. It's part of our responsibility with the development of these kids. Zaretta Hammond, who's the author of Culturally Responsive Teaching in the Brain, which is an amazing book. You know, a lot of what she says and what she writes is pretty much that the foundation of culturally responsive instruction is relational. And what she points out is that there is no checklist for how to be culturally responsive. It's about really wanting to know the youth that you work with. And we know that we also have to differentiate relationships, because some of our youth are coming to us that have had significant trauma from adults, from case managers, from social workers, from schools, from teachers, from principals, right? We know that we have students entering our workspace that already don't trust us. We have to build relationships and try harder to build relationships with those kiddos, because we know that there's going to be times that we are going to have to withdraw from them, which means maybe have to have having those tough conversations. We cannot withdraw from the youth until deposits have been made into that relationship bank account. You know, just one more thing. I always like to point out that there are going to always be kids in our space, whether it's kids in foster care, kids in our classrooms, in our school buildings, in our counseling offices, that because of resiliency, for whatever reason, they are going to be okay. And we know that. There are other kids in our space that have maybe had a similar situation to the kids that we know are going to be okay. And because of them not having the same type of resiliency, we have to really make sure that we are prioritizing relationship building with those kids first. Oh, Courtney said that she's not seeing the PowerPoint. Is okay, just Ashley says, anybody else not see it? Okay, it looks like Courtney, you might need to log out and log back in. So we want to make sure that we are prioritizing the differentiation of relationships based on the need of the youth that we serve. Things to consider when we are building these relationships, right? We have to know our youth's motivations and their triggers. What are they interested in, and what's going to set them off? What support systems are in place for these kids? What plans are in place? We also want to reiterate that we can only work with the youth when we are also in our thinking brain. So assess yourself in the situation, and remember that if you aren't at that baseline for yourself, it's okay to get another adult to support the youth. There is no shame in that. And one thing that I'd like to reiterate is that we want to work on meeting the youth's need versus requiring compliance. So think to yourself about what your non-negotiables are before entering the space. Power struggles are real. I mean, not that I've ever been in one, but I've heard that they're real. And so I added this slide in here because it's a great visual reminder of other ways to avoid or diffuse a power struggle, right? Visual supports are huge. Compromise is huge. I know when we're working with kids, we don't always like to compromise, but it's really important. I'm a big advocate for first then language. A trigger for some kids is the word no. And so when I have a youth ask me for something, I'll say yes when blah, 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 or yes, and you still have to first eat the vegetables and you'll get the dessert, right? So instead of saying no, I just reframe it, right? Yes, when, or yes, and. Educators especially love acronyms, as you know, if you're an educator. But just as a reminder, here is another new acronym for you, the TEAM acronym, right? So ways to remember about de-escalation. Techniques, this includes verbal and nonverbal, environmental and supportive modifications. We want to avoid coercion, and we want to maintain our calm. Some other things to consider. We have to have skilled listening. It's critical because we want to show our youth that we are validating them and hearing what they're saying. Turning into our own personal anxiety level so that we're assessing our own feelings. And then acknowledge the youth's feelings. We talk about fact as though fact is really, really important, which of course it is really, really important. But when a youth is escalated, in that moment, we're not worried about fact, we're worried about feelings. You might want to say something like, you seem very upset. I'm concerned about your safety and the safety of others, right? So acknowledge that. We want to make sure we are being empathetic with them. Right? We already live in such a judgmental world. Don't add to the judgment, right? Sometimes escalations look weird or irrational. That you can name it in your head, like, never seen that behavior before. Don't discount their feelings though. We mentioned this quite a bit today already, but respecting their personal space is so important. It also decreases their anxiety. Now, I will say the one caveat to this is when we are talking about sensory, some youth, in particular youth that are diagnosed with autism, that are impacted by sensory, right? Like a sensory overload. It might be helpful to know that because for some youth, having, that security, that weighted vest, the headphones so that it blocks out sound is actually going to be really helpful. Making sure we're using those non-threatening nonverbals. We talked about this earlier, right? We want to communicate a genuine concern, but as we know, the more somebody loses control emotionally, the less they hear. So they start to react to the nonverbal communication. We have to be mindful of this. The overreaction, right? We want to avoid overreacting because as we know, sometimes youth, this happens primarily with younger youth. If we start to overreact, then they also start to increase their escalation. I saw this recently in a school I'm supporting, a kindergarten classroom, where the teacher started calling in all the multiple other teachers to watch the students' behavior. And granted, the behavior was definitely annoying, don't get me wrong. Throwing stuff and just, being a kindergartner that was having a hard time. But when there was 6 teachers in the classroom, you can imagine that kid's behavior. It was he was showing off at that point. So when we start to overreact, oftentimes the kiddo will give us what we are looking for. Focusing on those feelings, right? Facts are important, but how a person matters or how a person feels is the heart of the matter. We want to avoid challenging questions, right? Because oftentimes this is what will lead to a power struggle. And so that's when I just kind of refer back to, I hear what you were saying. You are frustrated and you want an answer. We will talk about that later, right? We'll talk about it later. redirect their attention to the issue at hand. We want to make sure that, especially if there's a consequence, like in a school setting, a suspension, for example, we want them to have time to really understand what their actions mean, if it might lead to a consequence. And there's going to be times where we have to set limits, right? There are times when behavior turns violent to themselves or to others. So we have to let them know what we're doing. We offer concise choices and let them know consequences. We want to consider what we insist upon, right? So really think about, is this the end of the world? Am I willing to continue to be upset about this? Is this something that's going to be worth this escalation? Right? So these are things that we have to ask ourselves. And we have to make sure that we provide silence. Sometimes silence is the best form of de-escalation. And it's probably the least likely thing that we do. When we focus on trauma-sensitive communication, this is what we need to do. We ask the youth, what can I do to help? If we're in a crowded area, let's get out of that area. If they're extremely escalated and it's impossible to remove them from that space, create essentially like a shield around them, right? This is going to help to decrease the likelihood of that tension, but it's also going to give them some more of that respect. Use some reflective listening so that they feel heard. Ask open-ended questions. And try to leave the youth with options so that they don't feel like they're stuck in a corner, or they don't feel like the only option is the escalation. We want to create that rapport with the team as well, right? So many of you, I'm sure, work in a team setting. So talking together so that we're all on the same page, thinking about that common ground. When we're working with a youth who is escalated, we want to encourage their verbalization of anger. It's okay for them to be angry. We want them to verbalize it rather than act it out. So process that with them. And sometimes changing the subject can actually be a huge help, right? Sometimes just asking them, oh, I really like that shirt. Where'd you get it? Oh, are you from around here? What are you doing for the weekend? A couple things to avoid. We want to avoid any threats. And I don't mean like threats like, I know none of us are going to like threaten scary stuff, but we want to avoid threats like, if you keep doing this, we're going to have to stop meeting. If you keep doing this, I'm going to have to tell mom. When you act this way, it doesn't make me want to see you, right? We want to avoid any arguing and any lengthy explanations. We really want to avoid telling the youth that they don't have any reason to be angry. And I don't know about you, but the term calm down has never worked for me when I've been upset. And I can pretty much guarantee it's not going to work for the youth either. It's human nature to get defensive, especially because when our youth are escalated, sometimes they might make some targeted comments to us specifically. But we want to avoid that. And if we start to feel like, oh, that hit a sore spot, I can't support this kiddo right now, that's okay. Ask a team member to step in. We also want to avoid responses such as, oh, you're not the only one that feels this way, or everything is going to be okay. And we want to avoid any empty promises, right? I see this again, this is another school example, but I see this a lot, like a student will, like am I going to get in trouble? And a teacher saying, oh, you're not going to get in trouble. I can assure you, you're not going to get in trouble. Actually, there's going to be a suspension, but we just want to get the escalation over with, right? So there's times like that also where you're like, you know what? I don't know right now. I just want to make sure you're safe. And I see a question in the chat. It's hard to not set those limits when the real world sets even harsher consequences. So any ideas? What can you either unmute yourself and explain in terms of what the limits? What do you mean?
That's when you were saying, when you do this, then this results. Or, when you behave like this, it makes me not want to engage with you this way.
Yeah.
So there's a level of wanting to be honest with the youth, but also
Totally.
wanting to preserve the relationship and the connection. But
yeah,
sometimes the real world doesn't give that level of grace. So how do you maintain the honesty while also maintaining that connection?
Yeah, so that is a conversation that can be had after the escalation, right? When the kid has restabilized. In the moment, we don't want to make comments like that because all the kid hears is not when you do this, but all the kid hears is, I don't want to be around you, or you can't be in here anymore. And so those conversations are to be had when the kid and you are in that thinking brain. Definitely. And it's still an important conversation. That's that natural consequence. Like, well, buddy, you punched your best friend. They're probably not going to want to be friends with you for a while, right? So absolutely, we still want to have those conversations once they are restabilized. These are some other actions of what to do, right? In terms of following your instinct, we always want to prioritize safety. Sometimes we actually need a code word to alert for extra help. We want to make sure another adult knows where we are at all times when we are supporting a kid in an escalation. And again, there's some things that we want to avoid. We don't want to ignore the kid. We want to avoid coming too close. We want to avoid any analysis or interpretation of the youth's motivations. So I will just say this, right response talks a lot, and other restraint and isolation curriculum does talk a lot about the motivation, meaning like the underlying reason for why of the behavior, but it is not research backed. And so we want to be really cautious about focusing on any motivation of why the kid is doing something. And so lastly, and this kind of goes into what Maya, what you were mentioning about how do we actually have those conversations, is we do want to reestablish the environment, right? We want to ask the youth to explain what happened, and then we summarize our understanding of it. We want to discuss other ways the incident could have been handled, talk to them about actually getting a commitment to try an alternative strategy in the future. And that's when we then talk about the consequences. And sometimes those consequences are natural, like, I am going to need I need some space from you right now. What you said really hurt me, and I just need a little bit of space from you right now. And we also know that some of the consequences are more punitive. Regardless of consequences, reassure the youth that you support them. And you do this through your words and through, again, your calm demeanor. We're not using sarcasm. We're not pointing fingers. We've had the conversation. We're moving on. And just something for you all to think about. When you manage escalations or incidents within your work environment, what does go well for you? What doesn't work, right? What hasn't worked? And what are some key takeaways from this presentation for you to bring back to your work environment with the youth that you support? Are there any questions? All right. Well, I am sending, this is a slide just for myself to remind myself.
Actually,
Uh-huh.
I have a question.
Yeah, absolutely.
So as a classroom teacher, I wonder how can you keep that balance between, you obviously have a kid that is escalating, it's hurting physically and emotionally 20 other kids, and the kids look at you like, save us, and it's a little hard, you're like, I want to help these kids to de-escalate, I still want to keep the balance for the other 20 kids to see I got their back, and a lot of times it's really hard. What do you recommend?
Well, Natalia, yeah, that's not a little hard. That is really hard, just like you mentioned. And this is something that I hear all of the time, right? I'm in classrooms all the time about this specific issue, this specific thing. And this is where you really need to get team input. Like, you need other adults to be observing the behavior to determine, is this a behavior for communication in terms of, is the student trying to gain or avoid something? And if so, what can I start doing for tier 1, 2, and 3 practices to get into place? Or is this deeper and we need to start thinking about some wraparound supports, because there is no pattern to the behavior and we need to figure out another way to support the kid. There is not one teacher that can do this work alone. It has to be a team effort when you have a kid that is so escalating so frequently in your classroom. And I know that's a frustrating answer. And I hope that the admin that you are working with are supporting you on that. And please feel free, I'm always happy to do via email. If you want to send me some more information, I can definitely give you some other ideas. It's hard when I don't know exactly what the escalations look like, but the biggest thing that you need to recognize is you can't do this work alone. It has to be with a team.
Thank you. Yeah, I do have a good team, and we're working on it. So I just wanted to know if it's more, because a lot of times the kids that are victimized, they're almost felt like it's their fault. So we need to be very careful how we present this to the kids, because they were the victims. They didn't do anything to deserve that. And then sometimes the feeling is that, well, you did something to trigger, and they're like, no. So we need to be careful that we're not encouraging these kids or victims to be okay to be victims. You know what I mean?
Yeah, I see what you're saying. So you're really asking the question in terms of, how do we support the other students in the classroom?
Yes.
Yeah.
Yes.
So that goes back to like the community norm setting. What grade level do you teach?
I teach 4th.
Yeah, so talking to the students, and sometimes these conversations are best done in small groups, where you're just able to really connect, and maybe with the school counselor or maybe with the principal as well, of just talking to the students about, what does it feel like when this happens, and validating their feelings. At the end of the day, a lot of the kids who are in classrooms with students who have really strong behaviors or really intense escalations have a hard time feeling validated, right? They feel like, well, why does he get away with it, and that, that type of thing. And so I would say acknowledging and responding to the students, totally, like, to say, yeah, I would be upset too. Like, you have a right to be upset. Those are your feelings. And and just making sure that they know that. And then even for some students, if you're seeing certain students having a harder time, or maybe taking more blame, having more like private conversations with them about, even just understanding that every kid is on their own journey of like figuring it out.
Yeah, thank you so much.
Yeah,
and I just, for me, I think I'm very thankful that I looped with my kids, so I have a very strong community.
Oh, that's awesome.
And they feel no problem to talk about their feelings. I make them write down. I said, if you can't talk, write it down. So they wrote something. And so
Good.
we as a class, and a lot of times they say, you know what, maybe it's helpful if a lot of redirections would be coming from you. So we're working on it, but I just wanted to make sure that if maybe you had other strategies.
It sounds like
Thank
you're
you.
doing all the right stuff. Yeah. Awesome. Well, thank you so much, everybody. Next month, we are going to be starting a deep dive into social emotional learning, which will kind of carry us through the rest of the year, really. We'll talk about SEL work, but very specifically how to ensure that the social emotional learning curriculum that we're using and the work that we're doing is culturally responsive, because there's a lot of stuff out there that's not. And so that's what we're going to start focusing on next month. I did put the certificate in here for any of you, as well as the slides, and please feel free to reach out at any time if you have any follow-up questions.